In this lecture, we will discuss Chapter 22, where we will cover tolerance, autoimmunity, and autoimmune disorders. In these first few slides, we do have some terms. So please review these terms, make sure you are familiar with them, and that you understand their meaning. Now, factors that influence the development of autoimmunity. So autoimmunity will actually represent a breakdown of the immune system and its ability to actually be able to discriminate between self and non-self, so anything that is considered foreign. So this happens when there's any sort of immunoglobulins, autoantibodies, or cytotoxic T cells that will display any sort of specificity for self-antigen, and they will actually contribute to the disorder and pathogenesis of that particular disorder. And so it's going to begin with some sort of abnormal interaction between those T and those B lymphocytes when they're actually being targeting any sort of autoantigen or a self-antigen or any sort of antigen that is considered normal to that particular individual. Now, the potential for autoimmunity is always present in everyone who is immunocompetent. And this is just basically because those lymphocytes are always there and they have the potential to be reactive with any sort of self-antigen that exists in the body. They only need some sort of influence in order to actually switch to the component of themselves to actually be able to make antibodies against what we would normally consider a normal self-antigen. Now, some of these influencing factors are going to include things like genetic factors. So there does tend to be a familiar tendency for autoimmune disorders. For example, if you see lupus in a family, it tends to be more common in individuals who are in that familiar line, that they're all going to kind of be more predisposed to actually acquiring that condition. Patient's age can be an influence. So obviously the older you are, the more stimuli you've had over the years for some sort of immune response. So at some point you do have more potential to start targeting self. And so there is a peak incident about 60 to 7 years of age. There's also external factors. So this will include things like UV radiation, drugs, viruses, chronic infections, as well as an immunopathogenic mechanism. So this is when there is a production of the antibodies to the self-antigen that will actually bind to those antigens for specific tissues. And then they can actually, depending on how they form, can form immune complexes that will also ultimately lead to some destruction. Immunologic tolerance. So the importance of tolerance to self-antigens was actually recognized very early on in the study of immunology. So immunologic tolerance is the actual acquisition of non-reactivity towards a particular self-antigen. So basically it is your body's tolerance for itself. It's basically going to tolerate itself, because if it doesn't and it starts attacking itself, then obviously that's going to lead to self-destruction, and that's not what we want. So self-recognition or tolerance is a very critical process in which the body is actually has a failure to be able to recognize those immunological self-antigens, and then what this is going to do is actually result in an autoimmune disease process. Now, an immune process requires a presentation of a foreign antigen by an antigen presenter cell, and then another signal that's going to take place by the appropriate major histocompatibility complex that's going to be within that host cell. Now, both of these are actually needed in order for that immune process to take place. Now, with tolerance, there is a lack of immune response to the self-antigen. So, because we're able to tolerate our own self, we don't destroy ourselves. However, there are some things that can happen that can influence our body's ability to actually recognize and stop that. So self-recognition tolerance is induced by at least two mechanisms. So one of these mechanisms is the elimination of a small clone of those immunocompetent cells that have been programmed to react with an antigen. Now, the other mechanism is the induction of unresponsiveness in immunocompetent cells through the excessive antigen binding to them and through triggering of suppressor mechanisms. Now, there are layers to the tolerance within the human immune response. that are actually influenced by cellular activity as well as soluble mediators. And so we're going to discuss those now. So you do have these various layers of tolerance. So tolerance is basically started during fetal development. So this is that central tolerance stage. And during this stage, you actually have the elimination of cells with the potential to react strongly with self-antigens. And then you progress on to peripheral tolerance. So if that process is not eliminated within that first step, then that second step is where, or that second layer is where hopefully this process is going to take place. So within peripheral tolerance, you have a process involving mature lymphocytes, and this actually takes place within circulation. Now, within each of these, you have this whole process that takes place at different levels. And so if there is some sort of abnormality within those T or B lymphocytes that's detected in that whole process, then those cells are basically going to be eliminated. So they're not going to be allowed to go out into circulation. If it's recognized that these cells have the potential to actually start targeting a self-antigen, then the body's going to have this process of working through that. Now, I'm not going to go into all of this in a lot of detail because there are some videos that can kind of show you and explain this to you a whole lot better. So I'm going to save those videos for you rather than trying to confuse you anymore. So with autoimmune disorders, you actually have a higher level of immunoglobulins or autoantibodies that are present, as well as cytotoxic T cells that will display a specificity for self-antigens, autoantigens, and then they will actually contribute to that disease process and those breakdown of those normal cells. Now, it is characterized by persistent activation of those immunological effector mechanisms that will actually alter the function and integrity of the individual cells and organs. So you can have tissue injury that's going to be caused by those T lymphocytes, so those antibody reactivity to those immunological self-responses that's taken place. So in other words, these cells have been allowed to pass through those various layers of tolerance, and now they're at a point that they're actually targeting normal tissue. Now, the site of organ and tissue damage is going to be dependent upon the location of where this actual immune response takes place. Antibodies to self-antigens may be produced, and they will actually bind to antigens, and then they will form an immune complex. Now, complement can actually be activated with subsequent release of inflammatory type mediators, which will start to attract those phagocytic type cells. Now, those cytotoxic T cells can directly attack the body cells that have the antigen, in which they will actually release that inflammatory type of mediator. Now, with your major antibodies that are produced, these are actually what you're going to detect in these various disorders. So you're basically going to rely on the fact that the body is producing antibodies to specific organs in order to actually detect them. So you're looking for these autoantibodies that are produced. So they're actually going to be produced against specific organs. So examples could be something like thyroid, gastric, striated muscle, salivary glands, smooth muscle, mitochondria, myelin, skin. So they're just various antibodies that can be produced and detected. Other antibodies that you may be familiar with are going to be the anti-nuclear antibodies. And of course, these are looking at specific targets of DNA, histones, and non-histoprotein antibodies. Now, there are organ-specific and organ-non-specific disorders. So at one extreme, you have the organ-specific disorders, and then at the other extreme, you have the disorders that manifest as an organ-non-specific disorder. So with your organ-specific and mid-spectrum disorders, this is going to include things like your cardiovascular diseases, your collagen vascular disorders, endocrine gland disorders, various other organ systems like kidney, the GI tract, the skeletal muscle, skin. So these are just type of disorders that we're talking about here. Now, your organ-specific autoimmune disorders, they are produced by T cells and antibodies against antigen restricted to a particular single organ. So you're just going to have that one particular organ that's targeted. Now, you do have some systemic autoimmune diseases that will produce circulating antibodies or immune complex that will affect multiple organ systems, but it's still targeting a specific organ. So in organ-specific disorders, both the lesions produced by the tissue damage and the autoantibodies are directed at a single target organ. With your mid-spectrum disorders, this has a characterization by localized lesion in a single organ and by organ non-specific antibodies. So example of this will be like a primary biliary cirrhosis. So you actually have a particular cell type that is located within the small bile duct that is targeted. And so the serum antibodies are actually against the mitochondrial antibodies of that particular cell within the liver, but not necessarily the liver itself. Organ non-specific disorders. So these are characterized by the presence of both lesions and autoantibodies, but they're not confined to one particular organ. Now, your major autoantibodies, again, they're going to be what you're actually going to use to actually do the process of diagnosis. So again, where I mentioned that ANA being positive for various diseases, and due to the actual being able to test for the DNA, the histones, and the non-histoprotein antibodies, it's going to kind of give you a little bit of a different picture for some of these disease processes. Now, some of the similarities between these two are going to include circulating autoantibodies that will react with normal body constituents. So they all have an antibody to something that is self. There's increased immunoglobulin concentrations in serum that are going to be found, so you're going to find those Ig antibodies present. Antibodies may appear in each of the main immunoglobulin classes, so you could see them IgA, IgM, IgE, IgG, IgD, and so forth. It just is going to depend on what particular disease process you're looking at. Disease processes are not always progressive. You can have some disease processes in which you're going to have periods that it's going to be a little bit worse. The inflammatory process is going to be worse versus you're going to have periods of doing well and having remission. Autoantibody tests are of diagnostic value, so actually detecting the presence of those particular autoantibodies is going to help lead you in the correct diagnosis path. Now, just a couple of the comparable differences, because we have kind of covered a lot. Organ specific, you have antibodies and lesions that are specific to a particular organ, whereas organ non-specific, you do have those antibodies and lesions, but they're not really directed at one particular organ. So it can be directed at something a little bit more broad spectrum. With the organ specific, you're going to have clinical and serological type of antibodies that are going to be present, that you're actually going to be able to make this diagnosis. You're going to see a clinical approach to it as well as a serological antibody antigen approach for diagnosis. Antigens are only available to lymphoid system in low concentrations. Familiar tendencies, lymphoid invasion, as well as you'll actually have some liver cell type of destruction that'll take place. Tendency to develop cancer in various organs. Now, with the organ non-specific, you have antigens accessible at higher concentrations. You do have familiar tendencies that will develop for your actual connective tissue diseases. Lesions are caused by deposits of those antigen antibody immune complexes. And there's also a tendency to develop the lymphoreticular neoplasms. So there are a large number of autoimmune type disorders that we do see. Again, with all of these, you're basically looking for those auto type of antibodies. Now we're going to kind of briefly discuss them, just kind of be familiar with what they are and a little bit about as far as like what type of antibody you're going to see present. Now with your cardiovascular diseases, some things that we can see are going to be vasculitis. So with vasculitis, you're actually going to have those autoantibodies that are going to attack the cells within within those blood vessels. Now, the antibody that you're looking for is going to be specific to the endothelial cells of those vessels, and so we're looking for an actual anti-endothelial antibody. With carditis, basically you're going to have an inflammatory type of process that's going to take place. You're going to have this release of cytokines, and then you're essentially going to have some sort of damage that's going to take place. And so what you're looking for here are those antimyocardial antibodies. Collagen vascular diseases, so the ones to note here are going to be scleroderma. And so this is when you actually have a thickening of that layer of the skin, the scleroderma, and basically you're going to have that fibrosis and that hardening of that skin layer. Now with these patients, you're going to see those autoantibodies present. Depending on the particular form of it, will be a positive ANA typically for these patients, not always. But the ANA can distribute some different patterns for this particular disease process. The other one is an eosinophilia malaise syndrome, and so this one is just when you have that extreme malaise that happens due to contaminated L-tryptophan. And so this was something that was used years ago to treat things like insomnia, PMS, anxiety, things like that. The next set of disorders are going to be the endocrine gland disorders, so more specifically your thyroid type of disorders. So Hashimoto's, basically with this you're going to develop some sort of antibody that's basically circulating, that's cytotoxic to the thyroid gland itself. So it's going to produce various things that will target various aspects of that thyroid gland. And there are various types of antibodies that can develop to various components of the thyroids. So basically any sort of thyroiditis can be a manifestation of these various antibodies that are going to be present. And so we're actually, when we're looking for these, we're actually going to test some of these thyroid type of proteins to look for any sort of abnormality that's taken place. Graves' disease is a form of hyperthyroidism. So with this, you're going to see that low TSH, elevated free T4 levels. With these patients, they're going to have, at least 50% of them usually will have that thyroid peroxidase antibody, the anti-TPO, and then the TSH receptor antibody can help to discriminate between Graves' disease and any sort of toxic nodule goiter type of disease. Your pancreatic diseases, of course, the most familiar that you will be aware of is going to be your diabetes, insulin dependent diabetes. And so with this particular disease, there's a deficient insulin production that's caused by the immune destruction of the B cells of the pancreatic isolates. There are a few antibodies that can be detected with this particular disease process, things like insulin autoantibodies. Latent autoimmune diabetes in adults. So this is just basically a form of it that's just going to develop in older individuals, usually greater than 35 years of age. Autoimmune pancreatitis. This is characterized by an autoimmune inflammatory process in which the prominent lymphocytes infiltration with associated fibrosis of the pancreas, and then that's ultimately going to cause some sort of organ dysfunction, but just because you have that fibrotic activity within that pancreas, and it's going to kind of prevent it from doing what it is supposed to do. There are a few antibodies that can be detected within it. One that you're more familiar with is going to be that anti-smooth muscle antibody or ANA that could be positive. You can have adrenal gland disorders. One that you would think of would be Addison's disease. This is the disease that affects those cortisol levels, and with these patients you're going to see patients that are going to have antibodies against those cortical elements within the patient's cells. And so it's basically, you additionally will have some patients that will also have antibodies against those adrenal cell surfaces. With the pituitary gland, so you basically have antibodies that are directed against the pituitary cells, which is going to cause issues there. The parathyroid gland, so this is a childhood disease in which you have the antibodies, or you have a complement-mediated cytotoxicity of the parathyroid cells that is going to elicit an immune response within the parathyroid. And then you have the polyglandular syndromes, which is going to affect multiple different glands at various times at the same time. Reproductive disorders. So there are various autoimmune type disorders that can affect reproductive health. One thing to kind of make mention of that you're probably familiar with would be something like endometriosis that can affect the female's ability to actually, for those cells to actually implant, and basically you're going to have an abnormal production of cells, and it prevents the baby from implanting, and can cause some various complications as well as pain. And there are other things like anti-sperm antibodies that can be found in serum of men and women, in this cervical mucosa of women and the seminal fluid of men. So that can actually affect that seminal fluid, and ultimately affect the ability for reproduction, as well as there can be some allergy-like type of reactions that can take place as well. Exocrine gland diseases, so the one that you probably have heard of, Sjögren's syndrome. With this particular disorder, it's a chronic inflammatory disease of unknown cause that affects the lacrium, salivary, and other excretory type of glands. With this particular disorder, you can see similarities in other diseases, so it does kind of make it a little bit harder for the diagnosis. However, what you're particularly looking for is the presence of those antibodies that are usually polyclonal and may result in a hyperviscosity syndrome and hypergammaglobulinemia purpura. And so you're looking for that speckled or homogeneous ANA pattern in about, I would say about 65% of the patients will actually have this particular antibody or pattern for that ANA. Now there are other antibodies that can be detected, like antibodies to the salivary duct. So there are a couple of ways to kind of diagnose this illness, and a lot of it's just going to kind of depend on what is actually being affected by this particular disease process. Gastrointestinal disorders. So you have atrophic gastritis and pernicious anemia. So basically you have an immune system malfunction that's going to target the stomach lining, that's going to result in some sort of autoimmune gastritis, and then it's going to basically be characterized by chronic inflammation of the gastric mucosa, and then that can progress to pernicious anemia. And so with this particular disorder, you've got autoantibodies against these particular gastric cells that will affect those, which ultimately is going to affect the intrinsic factor, which basically ultimately is going to affect some of your absorption in B12, which of course you need for different functions within your cells. Autoimmune liver disease. So basically you're going to have this abnormal inflammation of the liver, and you're going to have the presence of these circulating tissue autoantibodies that are going to be directed more specifically at some of those cells that are in the liver. With this, you're looking for doing the testing for positive ANA type test. That's going to be looking for a particular pattern that will demonstrate the presence of this particular inflammatory process within the liver cells. Idiopathic biliary cirrhosis, so this is going to affect the actual bile ducts within the liver area. And then the patients will have an increased serum IgM, depression of cellular immunity with a prominent decrease in the suppressor T cells. Inflammatory bowel disease. So this is basically a collective name that's been given to Crohn's disease and ulcerative colitis. Within this particular disease process, you're going to have a presence of increased levels of inflammatory promoting cytokines and then protein molecules that are used by cells of the inflammatory system to actually communicate with each other. And so when you've got all this out of balance, it's obviously going to damage some of those cells and cause some fibrotic type of changes that are going to take place. And basically it's going to affect that whole GI process. There's also celiac disease, and so this is an autoimmune intestinal disease. With these particular patients, the damage to the mucosal surface of the small intestines is caused by an immunologically toxic reaction to the ingestion of gluten, and so it actually interferes with the absorption of various nutrients. And then, of course, there are some other gastrointestinal tract immunological disorders. Some examples of these would be things like, some sort of GI allergy, Whipple disease, immunoproliferative intestinal diseases, infectious hepatitis. So there are a lot of other various things that can elicit some sort of immune response that's going to inflame that whole GI tract. There also are a variety of autoimmune hematological disorders. Now these can be stimulated through any sort of autoantibody, so an antibody against self, or alloantibodies. These are going to be antibodies that are going to be directed against something that's considered foreign. So we have autoimmune lymphoproliferative syndrome. With this disorder, there's going to be a genetic defect in the programmed cell death, or the apoptosis, which is going to basically lead to a breakdown of lymphocyte homeostasis and normal immunological tolerance. Autoimmune hemolytic anemia. So there's a wide variety, or there's a group of disorders within this disorder, but basically you're going to have some sort of immune response. It could be various different ones. We're not going to go into those in a lot of detail because we will eventually go into these a little bit later. But basically with these autoimmune hemolytic anemias, you're going to have some sort of response that's going to cause destruction of those red blood cells. Idiopathic thrombocytopenia purpura. So basically with these patients, you're going to have some sort of signs of, some sort of platelets malfunction or something that's going on, bleeding. You'll have petechia bruising, the heavy bleeding, bleeding after a minor trauma. And so with these particular patients, you're going to have the thrombocytopenia, as well as you're going to have other things that are going to be present that are going to indicate that there is something going on, whether it be decreased platelet production, disorders of the platelets, and how they're distributed, increased destruction or use of those platelets can also be taking place. Now, antibodies of autoimmune origin can be a cause for this platelet destruction, so that's kind of why it's grouped here in this category. Neuropathies. So within your neuropathies, you have antibodies that are directed against those peripheral nerves. So when you actually start having that damage takes place within those nerve paths, then that's where the neuropathy or those nerve sensation type of pains come into play. Neuromuscular disorders. You have ALS. With this disorder, there seems to be some sort of degeneration that happens with the nervous system. Inflammatory polynephritis. So with this particular group of disorders. And again, a lot of these disorders, there are subsets of other disorders within them, but this particular disorder, we associate this with something like Guillain-Barré syndrome. So this is when you actually have an attack of those motor and cranial nerves, including some of those sensory nerves. And basically with these patients, that whole nervous system, that peripheral nervous system is attacked, and then they're unable to do kind of some basic functions within that neurological system. And some patients end up going on life support if it gets severe enough. Mesothenia gravis. So with this disease, it's a disease of the neuromuscular junction. And so you're going to see with these particular patients, you're going to have antibodies that will basically damage various aspects of the patient's neuromuscular junction. And so you're going to have some abnormal responses of those neuromuscular or skeletal muscles for those particular patients. Multiple sclerosis. So basically with this disorder, you're going to have attack of the central nervous system. So you're going to have some demyelinating of those central nervous system nerves, and that's going to be to an attack of the body against itself. Renal disorders. So within the renal disorders, some that we're going to talk about, renal diseases that are associated with circulating immune complexes. So with these disease processes, basically you're going to have an initiation of some sort of immune complex that's basically going to attack the glomerula. So basically the kidney, and more specifically the glomerular basement membrane. And so when this process takes place, you're actually going to get damage within the kidneys. One of the diseases that we kind of associate this with was going to be with lupus. Membrane proliferative glomerulonephritis. So this is basically a form of a glomerular disease that's going to have some sort of activation that's going to happen through C3 due to some sort of bacterial products or polysaccharides that are present. Renal disease associated with anti-glomerular basement membrane membrane activity. So anti-glomerular basement membrane antibodies are directed against the glomerular basement membrane of the glomerulus within the kidney. So that's where this attack is going to take place, and basically it's going to cause damage to that kidney. Tubular intestinal nephritis. And so with this particular disease process, it's going to involve the renal tubules that will cause some sort of immune complex mediated disease that will take place within the kidneys that will lead to this disease process. Skeletal muscle disorders. Examples of this will be inflammatory myopathy, and so this is when you actually have some sort of chronic inflammatory disease that's going to take place within the various layers of the muscles, and as well as the various skeletal muscles, as well as those various layers within the skin, joints, lungs, heart. So it can actually cover a variety of layers within those muscles, but basically it's just going to have some sort of breakdown to that tissue. Then there's also some skin disorders that can affect the various layers of the epithelial. So you could have like something that will affect the dermal layer and the intraepithelial layers. So it's various antibodies that will come up against those particular layers of the skin and then ultimately cause that disease process to take place. Now again, we've covered a lot of disorders. I'm not expecting you to know a lot of detail on these. Just know that each of these disease processes that we do talk about, we've kind of covered them over a variety of different courses now. So you kind of are starting to see some links between the hematological aspect as well as the chemistry aspect, and then we're now kind of branching over into your immunohematology blood bank area, as well as your micro area. So a lot of these disease processes, you've got to kind of start seeing and understanding there is some cross reactivity within the departments as far as the results that you're going to see with these disease processes. So just keep that in mind. That's the main thing you need to do, is start kind of bridging those connections of these processes that are taking place and how it's going to affect various aspects of the laboratory as far as results for these patients. And ultimately what you're seeing, that, you know, all of these disorders, there's some sort of abnormality that takes place that causes everything to start.